All right. So good evening, everyone. My name is Marche Jones. I'm actually the director of CCPU Healthcare Fund Operations, and I'm very happy to have you all with us tonight. Um, we welcome you to this webinar, and it's being brought to you through our union, CCPU. So a big round of applause for all of our partners and all of you for joining. We have quite a bit of fantastic information to share with you all tonight. What we're going to be going over will be important information about the program, what you need to actually stay eligible this year and the next, and some valuable benefit information that you're hopefully going to find extremely helpful. Two important reminders before we get started in the agenda for tonight. Number one, for all of you, we are proud to offer free healthcare benefits to all eligible CCPU providers. And that second thing that we want to go ahead and point out to all of you is that the CCPU Healthcare Fund does not request or collect any information about people's authorization or immigration status. So with that being said, before we jump into the presentation and all of that great information, I would love to start this session off today with an update about the union, and I would invite Anita up for this important announcement. Anita?
Thank you, Marche. Hi, everyone. First of all, I'd like to extend a warm welcome to all of you, my fellow educators, as we gather for this webinar tonight. As Marche mentioned, my name is Anita Vicini. I am a large licensed child care provider based in Tuolumne County. For the past 14 years, I've dedicated myself to educating the children in our community, striving to make a positive impact on the lives of the families and the children that we serve. In addition to my work as a provider, I've had the privilege of serving as a member of the bargaining team, advocating for the needs and interests of our profession. I currently am an executive board member for SEIU Local 521 and serve on the Budget and Finance Committee. Throughout my career, I have been a strong advocate for quality childcare, committed to supporting both providers and the families who depend on us. So for the next few minutes, we'll be chatting about our union, CCPU, and the vital role it plays in uniting, and empowering early educators like all of us tonight. So the union, our union, is a community made up of early childhood educators from across California, including both licensed providers and FFN, or friend, family, neighbor providers. Our membership is diverse, with some educators having served families for 3 or 4 decades, and others who are just starting their career in the field. We are the union. The union exists to enhance the lives of its members and the families that we support. The core purpose of the union is to bring providers together to achieve meaningful improvements, both within our profession and throughout our communities. By uniting, we can collectively work towards positive changes that benefit all of us. More than 70,000 early educators across California have come together to form our union, Child Care Providers United, or CCPU. As members, we not only belong to CCPU, but also participate in our respective local unions. So we have SEIU Local 521, SEIU Local 99, and UDW. This dual membership empowers us to drive meaningful change both in our local communities and at the state level. By acting collectively, we strive to enhance the quality and affordability of childcare while also improving the pay and benefits for all early educators. Our commitment extends to ensuring childcare to all families, regardless of their background, language spoken, county, or license type. We believe that by uniting our voices and efforts, we can create a stronger, more equitable system for both providers and the families that we serve. I want to take a moment to share how being a part of the union has made a significant difference in my professional life. I joined the union 14 years ago, um, well before some of these outstanding benefits that we now enjoy came to us, right? Um, Throughout these years, I have remained a proud union member. Several years ago, providers in my county struggled to receive a stipend from our local resource and referral agency. The situation was challenging, and many providers in my area were frustrated by the overdue payments and felt unsure about our options. When I reached out to our local union, SEIU Local 521, my organizer stepped in, and together we were able to get the necessary funds released the very next day. This swift resolution was a tremendous relief for all of us, and we were grateful for the union's support. More recently, and listen, when I say more recently, I'm talking 2 months ago, I encountered major difficulties receiving payments from our county's welfare to work program for a stage one participant. Despite sending numerous emails to the client's worker and their supervisors, the issue remained unsolved for months. Once again, I turned to the union for help. With the support of both my local union and CCPU, we successfully secured the payments that had been long overdue. Navigating complex policies and procedures is not always easy, especially when it comes to regulations and laws. Thankfully, CCPU provided expert guidance on what should be included in the demand letter and referenced the relevant regulations and policies. Having the union's assistance made a substantial difference, and I could not have achieved the outcomes without their support. So, who is CCPU? Oh, next slide, please. There we go. So, how we won. Our victory was achieved through solidarity by coming together as providers. After a determined 17-year effort, we successfully organized CCPU in 2019. CCPU brings together 3 local unions throughout California. Again, those are SEIU Local 521, SEIU Local 99, and UDW. Unionizing gave us the legal right to negotiate our contract with the state of California, allowing us to address and improve our working conditions. We secured a law that established our union rights. This law empowered CCPU to bargain for benefits on behalf of providers and guaranteed that providers would have a direct voice in shaping those benefits. Once the bargaining team and the state of California reach a tentative agreement, it is put to a vote. Every child care provider who is a member of the union has the opportunity to vote and make their voice heard. However, only union members are eligible to participate in this critical decision-making process. Personally, I value having my voice count in matters that affect me personally in our profession. Being part of the union means being involved in these important decisions and ensuring that our votes help determine the future of our work. So what's the power of membership? The next slide, please. Power of membership. As childcare providers, we sometimes deal with delayed payments and confusing policies. By joining together in CCPU, we've made real progress in solving these problems. CCPU members help support valuable trainings and take part in negotiations with the state to improve rates and policies. I told you about the problems that I had with payments and the issues with our local resource and referral program. As an active union member, I now know exactly what to do when payments are delayed. Instead of handling the problem alone, I work with union staff and other providers to find solutions together. This shows the strength and unity of our union. The key to making our union even more robust and effective is by increasing our membership and participation. By joining CCPU, taking an active role, and ensuring your voice is heard, each provider contributes to our collective power. Imagine the possibilities if every provider was a union member. We could accomplish so much more together. Becoming a member is simple. It involves standing shoulder to shoulder with your fellow providers to ensure our voices continue to be heard and respected. Growing our membership also strengthens our efforts to secure fair pay and reform the cost of care. You can sign up right now by using the QR code that's in front of you on the screen, or there's been a link provided in the chat. We'll pause for briefly to allow everyone the opportunity to join and become a member. We also invite you guys to follow CCPU on Facebook and on Instagram. I appreciate your guys' time. Thank you so much. If you have any additional questions, please reach out to your local organizer. I hope you guys have an amazing night.
Thank you, Anita. And we'll go ahead and pause now to give providers a chance to utilize that QR code. All right. Hopefully, everyone got to engage with the link in the chat or the QR code that was previously displayed. If anybody also would like to check out the Facebook page, Instagram page, or website, as Anita mentioned, please take a moment to screenshot or um, take a look and add these as accounts you would like to follow. Right, so we'll go ahead and get started, everybody. All right, so this is our agenda for tonight. So we're going to start with program updates. We will move into end of year business. We'll also circle down to proof of coverage for 2026. And then we will round this thing out by leaving a nice chunk of time at the end to do questions and talk about some resources. As a reminder, again, we heard your request and we'll absolutely have time for Q&A at the end. As a bit of housekeeping, so that we make sure that this thing runs smoothly, just a couple of things we want to call out. The first of which is that if you have case-specific questions, we do not want to answer those via the webinar because we do not want to memorialize in a recorded webinar any personal identifying information or any possibility of personal health information. So if you do have something that is a specific question and it is contains PII or PHI, tonight what we will do is we'll ask you to just put it in a chat to the host and panelists, and we will take this back and actually reach out to you specifically after tonight, and then we'll take care of whatever that item that you're flagging for us is. Um, right, let's go ahead and get started. All right, so before we jump into those updates, I just want to do a really quick introduction of our wonderful healthcare fund trustees. So the CCPU Healthcare Fund is a healthcare trust governed by a board of trustees. So the trustees are appointed by SEIU Local 521, SEIU Local 99, and United Domestic Workers and AFSCME Local 3930. The members of the board are actually a combination of providers like you all, and additional to that would be a staff representing from each of the three unions. Right? So hopefully some of these people up here look familiar. If not, you should certainly reach out to them and get to know them because these are the folks that are helping to make the decisions about the healthcare fund. And they always want to hear your feedback on what works well and what changes or enhancements you guys would love to see. Right, so go ahead. All right, so jumping into today's presentation, we're going to go ahead, like I said before, and walk through everything you need to know in order to close out the 2025 program year and really get you ready for 2026 and taking advantage of those healthcare benefits. We will cover key deadlines, required documentation, important reminders, and to make sure you are set up for success. So let's start out with some important updates and reminders to help you finish out the year. So over the last few months, we made some big improvements to make it easier for you to access benefits and stay covered. So the first of which we'll talk about tonight is going to be the updates to our eligibility requirements. So as a quick recap for those of you who may not recall, but traditionally the way that this program works, right, is there are three things that providers have to satisfy and in order to get enrolled into the healthcare fund. So number one, you have to be paid for working with a state subsidized child. Number two is you have to be enrolled in a qualified health plan. And then of course, number three is you have to complete a reimbursement program application. The takeaway here is that these three things were creating, unbeknownst to all of us and the board of trustees who actually made that decision as this is the criteria, we realized that, hey, this is actually creating a barrier to benefits for some providers. So there were lots of discussions and work done around what can we do to make this program easier for providers to get access to and to continue to be able to enjoy the benefits that were won on your behalf. So we heard your feedback, um, and we've made it simpler. So let's talk about what the change is. So effective October 1st, so this has now happened almost 2 months ago, providers only need to meet the following criteria to be approved for the healthcare fund and access what we're calling core benefits. So now providers only need to be paid for the for working with a state subsidized child and complete a healthcare fund application. And before it was a reimbursement program application. So if a provider now submits a application without their proof of coverage, but they still meet those other two requirements, remember working with a state subsidized child for the appropriate period of time, and completing an application, you will gain access now to the fund's core benefits. Um, what this means is that missing proof of coverage documentation will no longer prevent providers from gaining access to the healthcare fund and being able to participate in the majority of the healthcare fund's offerings. So as a quick overview, for those who aren't familiar with the term core benefits, let's run through them really quick. So if a provider applies for the fund, they work for state subsidized children, and they do not provide proof of coverage, you still gain access to all of these amazing benefits. So that's going to be free dental and vision coverage, free basic group term life insurance policy for the provider. You'll have the option to also select voluntary life benefits at a cost. You will also have access to the provider assistance program. And then if you add your family to your account, your family members will also be able to take advantage of all of these offerings except the basic group term life insurance. That one benefit is a provider only benefit. All right, so now if you do submit proof of coverage, that opens the door to all of the benefits. It's going to get you core benefits plus reimbursement benefits. So that means you'll get access to your free healthcare fund dollars that can pay for things like, premiums and out-of-pocket medical costs, in addition to all of the core benefits that we reviewed on the previous page. So think of it sort of like this. Submitting proof of coverage with your application will immediately turn on your access to everything the healthcare fund has to offer. Our goal is to absolutely try to get all of our childcare providers active in everything across the board. But if you don't provide proof of coverage, or you don't want to enroll in a qualified health plan, providers will continue to actually have access to those core benefits. So again, just as a recap, if you submit your proof of coverage, you will have access to all of the core benefits that are listed here. And additionally, you'll also get access to reimbursement funds. So the whole offering. All right, so here's a quick reminder of what those reimbursement benefits can include. You can receive up to $9,450 a year for a provider-only coverage, or you can actually receive up to $18,900 for family coverage. So that's free money to not only cover your healthcare expenses, but if you have eligible family members to add to your account, this is also money that you have access to help pay for your eligible dependents or spouses, healthcare coverage as well. You can use it for things, of course, like doctor's visits, co-pays, prescription medications, lab tests, and medical equipment. And you can also use your debit card, right, to help pay for items so that you're not spending your money out of pocket. or you can, of course, file a claim if you do spend your money out of pocket, and we'll reimburse you for those funds. It's a very flexible design for this portion of the healthcare fund's benefits, and it's really designed to support you. What I'll call out before we continue is that if you are a provider who is enrolled in this benefit with the healthcare fund, you absolutely want to make sure that you become familiar with sort of how to ensure that you can continue successfully use the healthcare fund benefits as it relates to the reimbursement fund. So that's going to mean as providers, right, that you're going to want to make sure that every time that you're using the fund's money to cover your medical expenses for yourself or your family, that you are absolutely keeping a good copy of your receipts, because you may have to submit them to us to substantiate those charges and make sure that they're eligible. And you're also going to want to make sure that you log into your reimbursement portal to monitor any communication that we may have with you about any of your reimbursement benefit transactions. And if you have questions about that, let us know at the end and we can talk a little bit more about that. All right, so here, some good stuff. So I also want to take a little bit of time to talk to you all about some of the changes we've all been kind of hearing about as it relates to federal health care and the things that are changing because of the things happening currently in the government. So as a reminder, aside from the stuff that's going on right now, every year federal laws in general change, and they can impact what people pay for the healthcare plans. So that's whether you're on, a plan like Medi-Cal, Medicare, or of course, if you are one of our providers on a covered California plan. So many of you I know have been hearing a lot about premiums increasing and all of these different qualified health plan areas. But I'm here to really hopefully provide some alleviation and to kind of, grab your hand and let you know that the healthcare fund is here to support you, and we will pay those increases on your premium. So if you are a provider who, you're going to Covered California to renew your silver level HMO for 2026, and you're noticing that, oh my goodness, there's a steep increase in my premium for next year compared to this year, don't be alarmed. The healthcare fund will lean in and pay that difference, so you should not feel the impact. Um, the key takeaway here for everybody is don't let premium changes stop you from getting the healthcare coverage that you deserve. These funds are here for you, and we're going to support our providers and make sure that we keep you covered, your health plans active, and that you're also active in our program, and we're helping to support and with those out-of-pocket costs. All right. So the last update I want to let everyone know about is going to be concerning our eligibility. So the great news is that beginning January 1st, the fund is moving from quarterly eligibility to annual eligibility. Now, most of you might kind of be looking at us weird, like, what are you talking about? And you may not have, had a full appreciation for the eligibility happening quarterly. But what this means is that you will not be inundated every quarter with information about your eligibility status and whether or not you need to supply additional information to remain active. What this really means is that when you are approved for this program now, instead of us taking a look at you every quarter to say, hey, does the provider still have enough payments, subsidized childcare payments to stay active? Or does this person still have an active healthcare plan? Or what's this provider's scenario? Instead, now, when you are approved, your benefits with the healthcare fund will stay active for a full year, not just 3 months. So what that means for our childcare providers is it'll be only one approval needed every year. We won't be messaging and blowing up your inboxes or texting you with notices every quarter with calls to action. Which means, in general, our childcare providers are very, very busy, right? You guys are out there literally doing the Lord's work, taking care of the children in the state of California. So we want to do what we can to, number one, keep you in this benefit um, as long as humanly possible, while also giving you more time to really focus on your work and not have to worry about trying to engage with us during your business hours, which obviously for all of you will mean less paperwork and fewer deadlines. So essentially, if you already got a redetermination notice last month for 2026, letting you know, hey, you're approved and you're good to go, or we need proof of coverage. Once we get that proof of coverage, we won't talk to you again for another year. So it'll be next November when you hear from us again. All right. And if anyone has questions about this as well, please put them in the chat or raise your hand at the end and we'll answer those live. All right. So let's go ahead and actually talk about how to close out 2025. There are a few key things that you'll want to keep track of in terms of deadlines, receipts, proof of coverage, and all of that in order to be successful with closing out this year and being prepared to roll into 2026. So we'll go over what's due, when, and what documents you'll need to make sure you don't miss out on any of the reimbursements. So the first thing I'll start off with is the end of year notices. So if you're looking at the screen right now, you'll see sort of some screenshots of the end of year notices that have gone out to providers. So everyone on this call, if you are currently active in the healthcare fund or you have been active at any point this entire year, you should have gotten one of these notices in the mail. If not, it may be on its way. So keep a lookout in your mail. And we also sent you a link to this notice in our webinar invitation email that we sent out a couple of weeks ago. So what's important about this is, you want to really take a look at this notice because it's tailored to you and the specific, qualified health plan that you're enrolled in. It's going to contain quite a bit of information about what you need to know about continuing benefits for next year, and anything that you need to do to close out 2025. So just want to flag that to keep a lookout and pay attention to this notice because it gives you all the information that I'm going to cover today. All right, so let's talk about runout period. So each year, the healthcare fund must close out the books to start a new year's fiscal cycle. To do this, all claims and reimbursements for the current year must be submitted by a set runout deadline. That means for our program, all 2025 claims and reimbursements must be submitted by March 31st, 2026. This has been our same deadline every year that this program has been active. And it also follows the majority of other healthcare reimbursement plans that are offered even from like employers. So I want to talk a little bit about this because this creates a little bit of anxiety every year with providers, in order to get their documentation in order to close the year out. So let's kind of talk about what this means. So if I'm a provider and I swipe my debit card, right, to pay for my deductible because I'm having surgery in December of 2025, right? This means that because I swiped that card, I'm going to need to submit the appropriate documentation to the healthcare fund in order for us to approve it as eligible and close that claim out for you or that transaction out for you so that you are good to go for 2026. What we see happen sometimes is that one, a provider may swipe their debit card. They're not checking their message center in the reimbursement portal, or they're submitting documents to us, but they're not what we need to actually settle and clear the claim. So what happens is that our team is working with you to try to get the information in before this date. Unfortunately, this date comes and passes, and then a provider can reach out to us after the 31st of March and say, oh my gosh, here's the correct document that you need to close out that claim. And then we have to say, unfortunately, because we didn't get it by the deadline, it means that now you have to repay the monies that you spent in 2025 for that claim. And if they, the provider has that scenario, which we want to avoid this at all cost, everybody, but what can happen is that you'll end up in a repayment scenario and you could potentially, and if you get to a repayment scenario, it means your debit card is going to stop working. So that means until you actually repay the healthcare fund, it'll essentially pause your reimbursement benefits with the healthcare fund until you settle that. I do want to highlight, however, that it does not stop you from utilizing your core benefits. So dental and vision, your life insurance policy is still there, um, and so on and so forth. So just some additional information for all of you. So all reimbursement claims again, and any required documentation needing to approve those claims for this year have to be submitted by March 31st. So if you have some outstanding claims or you're not sure if you do, log into your your reimbursement portal and take a look, and then navigate over to your message center. Because if you do, we have sent you notices to let you know what we need, and where to send them. You can do this again by logging into the reimbursement portal to upload your claim substantiation. You can also email us at reimbursement@ccpuhealth.org, or you can mail them to us, also if you prefer that, at our PO box listed on the slide. But again, you want to really make sure that it's postmarked by March 31st, because if it's postmarked April 1st, we'll get it, but we won't be able to accept it and apply it to your claim. All right. Last thing I'll mention as it relates to run out period is that this deadline also applies to your debit card transactions. Right? So again, a lot of times we swipe the card and then it's like out of sight, out of mind, right? You paid for your transaction. We think it's all good and fine. And then we find out later that, hey, you actually needed to submit documentation and you didn't. So again, just be very vigilant. Check out your message center and the reimbursement portal. Or again, obviously, you can always reach out to us and we can take a look and see what we have outstanding for you that we need to get clear. We're more than happy to help out with that. All right, let's talk a little bit about acceptable reimbursement documentation. So as we're talking about, the transactions that we're wanting to get cleared before the 31st of March in order to close out 2025, let's talk about what some of the documentation needs to look like. So all supporting documentation, I know as many of you know, have to have 4 things for us to accept them as documentation to clear a claim or a charge that you make for a service. It's going to be your name, or if you have family benefits, right, the name of your eligible dependent if it's their charge. We're going to need the date of service, or the date that the goods were purchased. So the reason why we need this is because this program, the reimbursement side, this benefit will only reimburse providers for eligible transactions that occur while you are active in the fund. Another scenario that we see a lot is that if a provider has, like a service that happened, in like, let's say 2022, it was a really big surgery. And they started a payment plan with the hospital to pay off their portion. Those cannot be submitted to us to pay because it occurred before your effective date. So you just want to be very, very careful and just understanding that, your eligibility start date in the program is going to help dictate when you can actually start having the fund pay for your eligible healthcare expenses. The other thing that we need to see on there, of course, is what were they paid towards? And it's going to be things like we're going to need to be able to delineate, like, was this a copayment? Was this a deductible payment that you had to make? Was it co-insurance? Was it something else that was covered by insurance? And this is the remaining portion that you have a responsibility to pay. Um, As a reminder, submitting the correct documentation is essential to quick processing of your claim. So you want to make sure that third one is probably the hardest one for providers to ensure that we see on that documentation. We want to make sure that that's on there. And then lastly, of course, we want to see the amount, right? If you're requesting a reimbursement, we need to see what the amount is. That way, once we approve it, we make sure that either we're reimbursing you the right amount or the charge that's in the system matches the substantiation that you provided. All right, so let's actually take a look at a couple of examples. And I know we don't get to do this very often, so I'm super excited to actually kind of give some examples. That way it'll kind of help you understand why some of the things you may have submitted in the past or something that you want to submit didn't work. So here's an example of an invoice, right? So this is something that you might get from your doctor's office or maybe from a hospital visit. And it's going to essentially tell us the four things that we need to know, right? So in this scenario, we see the patient name, right? It's going to match the provider name in our system or a dependent. We're also going to see that there's a date of service, right? So it's going to tell us, hey, the provider sought services on this date, and then our team gets to go in and verify that, yes, this provider did have benefits in our system active during this period. Again, the next thing that we're going to look for is what were these charges paid towards. So for us, we're going to look for information about the payment that lets us know that insurance paid a portion and what the provider has paid is their provider portion. That's the key because we have to remember the healthcare fund works with your healthcare insurance. It is not healthcare insurance. So in this scenario, there are remarks about the insurance, right? So the remarks let us know that this payment that the provider is making is an actual deductible payment. So we know right there, just because of the word deductible, that this is a charge or a service that was covered by insurance. And what the provider was wanting us to help pay for them or reimburse them for is their provider portion. So this item, along with the amount, would have the four things that we need to pay this claim. Explanation of benefits, everybody, is the creme de la creme of, of substantiation documentation. The reason why is because if you provide an explanation of benefits, it is going to 100% verify that whatever you're seeking reimbursement or approval for was an eligible expense with your health plan. And it's going to dictate, it's going to have all four things. It's going to tell us what date the service was rendered. It's going to tell us how much your insurance applied to pay whatever service that was. And then it's always going to tell us what the provider premium is. Excuse me, the provider responsibility is. So explanation of benefits is the best, but these only come from your health insurance. So typically with providers, we love to get these, but these can take a little while to get. So just wanting to flag this for everybody. If you're struggling with what do I submit, what do I submit, you can always reach out to your health plan if you have not received an explanation of benefits and request it, because this is the foolproof way to get your claim approved with no headache. All right, and then next, obviously, is just our standard receipt, right? So a lot of times we have providers swipe their card, they get like a Visa kind of looking receipt that doesn't have a lot of information about what the service was or what the payment was towards. So it kind of looked like this on the right, this Kaiser one. And then you'll see for this provider, they also, in addition, had to submit an additional document from Kaiser that coincided or worked together to help us verify that transaction. So again, it's listing their name, it's listing their date of service, it's listing the amount, and it's letting us know that, this was a payment that was submitted as a copay. All right, and if you're a provider that is on like Medi-Cal, right, or Medi-Medi, you have a benefit known as permissible, right, which is a little bit different from the out-of-pocket benefit in that some of the rules are a little bit different. So for our permissible expense plans. Providers who have this, they'll be submitting receipts that typically are more itemized, right? Things like going to, Walgreens and purchasing cough syrup, right? It's not going to look like a receipt from the doctor's office, right? It's going to look like a typical Walgreens receipt. So those things they do look different, but they need to be itemized so that we can verify that the purchase that you made is on that permissible expense approval list. And then we also want to make sure that any prescriptions that you're picking up using your debit card or benefits, they show that medication is for you or an eligible dependent. So again, you may need to submit just information about the prescription. You do not, however, need to provide us the name of the medication or any of the dosage information, right? You can absolutely keep that confidential. But us needing to see the name of the name of the person the prescription is covering and marry it to the receipt for the purchase that was made, that's what we're going to need to see. We also have things like with our permissible plans, if you are seeking services like optometry services, right? Because this plan will cover some out-of-pocket costs for dental and vision services. Again, we're going to need to see all four things that we needed to see for the other substantiation examples, right? So the four things. And then we have instances where there are some transactions that are acceptable as long as they come with a letter of medical necessity. So there are providers that will need to make purchases of things that are not covered by insurance. And they could be, there's a whole list of things that we could go through. And typically, if we have a provider that has that scenario, what we have to ask them for is just to get a letter of medical necessity and we can approve it, right? And that just requires them to go back to their physician who basically advised them to go purchase this item for a treatment of whatever illness or whatever ailment that they may have. And if they're able to provide that, and again, it doesn't need to tell us a diagnosis of anything. It just simply needs to say, I saw provider, Marche in my clinic and I prescribed her crutches. I'm just going to throw something out there. I prescribed her crutches, insurance, and and it's medically necessary. That's all we need to see. All right, so let's talk about proof of coverage for 2026. So we've talked so far about the things that have changed in our program and what changes are upcoming. We've also talked about what we need to do to close out 2025. So let's talk a little bit about what we need to do to get you ready for 2026. The first of which is proof of coverage. So to continue or begin reimbursement benefits in 2026, you will need to send us your proof of coverage. So again, that end of year notice that I showed you a graphic of prior, you'll want to make sure that you read that because it is specific to your actual qualified health plan. It's going to tell you exactly what you need to submit to us, whether it be a covered California case, a Medi-Cal or Medicare case, employer sponsored, or something else. So again, when you submit your proof of coverage, it's also going to need to have four things: your name, the effective date of the health plan. So the date that I want to see that will make me the happiest, submit something to me that tells me it's effective January 1, 2026. Because that's super clear and it'll get you covered for the whole year. We're going to need the name and the type of your health plan. And we're going to need, of course, your premium if you have one. And if you are on a covered California plan, you do want to make sure that you submit premium information that also shows any APTC or advanced premium tax credit that Covered California may be providing to help you pay for that. All right, so quickly, we only have a few slides left and then we'll launch into Q&A. I just want to look at some examples with you all. So if I am a provider that's on Medi-Cal, here are a couple of examples of documentation that is acceptable that will clear you. So number one is your 1095B. If you are on Medi-Cal this year and you're also going to be on Medi-Cal next year, Um, you can provide for us your 1095B for 2025 to get us so that we continue those benefits over in 2026. The one document that is, I think, my favorite for Medi-Cal participants is this middle one, and it's known as the Verification of Benefits letter. I love this one because this isn't a letter that providers can generate themselves by logging into their benefits Cal accounts and clicking the button to create their verification of benefits. This will also work, and it always works perfect because it also will show your dependents if you have those that are enrolled in the same plan. Takes care of everybody with one document. Um, in the same vein, if you log into your benefits Cal account, like in your mobile device, and you just want to take a screenshot of your healthcare benefits screen, it's going to tell me what your renewal date is so that we know that those benefits are good for a year. So I'll know what your effective date is. It's going to give me the name of yourself and or any dependents that you have. And then obviously with Medi-Cal, we know that there currently is no premium. All right, if you're covered California, the easiest way to do this, if you have not received anything in the mail to submit as of yet, is if you have access to your Covered California portal, or you're working with a broker who is enrolling and helping you with your Covered California, they can take a quick screenshot of your benefit summary. It's going to have all four things that we need in order to get you enrolled and continuing for 2026 with reimbursement benefits. So again, you'll see your premium, you're going to see your APTC, you're going to see your effective dates and any covered members that are active in that plan with you. And then, of course, you may also get like a regular old premium billing statement from your health plan with Covered California. So again, we'd be looking for the name of your health plan. It's a silver HMO plan, so this is perfect. You're just going to tell us the people that are actually covered in this plan, as well as your effective dates and your premium amount. All right, if you are on employer sponsored, you can submit things to us like a certificate of coverage generated like from your HR. You can also, I think the easiest, especially in this season, since a lot of folks are in open enrollment selecting benefits with their employer, you can always just log into whatever portal you engaged with in order to select those benefits, take a screenshot. You do not have to give us all of the information that's in that benefit summary from your open enrollment, but we just want to see the medical section of what you selected, who's on the plan with you, and the amount you're paying and the effective dates. And then the last thing, of course, is that you can absolutely always submit a pay stub if you're having employer-sponsored benefits through an employer. What we need to see on this is just your medical plan deduction, the amount you're paying, and then of course your name. All right, and the last one we'll cover in terms of examples is going to be for Medicare. So I know this is the one that there's a lot of talk about right now. And these are the three documents that are easiest for us to certify that you're in the right plan and to update any premium information and then continue your benefits for you in 2026. So the first of which is if Medicare sends you a premium billing statement, obviously it's going to have those four things on there. So this works. What we also love to see is our Social Security Administration benefit verification letter. This notice typically comes out every year for folks that are on Medicare. It's going to tell you when your benefits are going to be active. It's going to tell you if there's an adjustment to how much you're paying for Medicare. It's also going to give you any information about what that new Medicare payment is going to be. So if you get this notice, send a copy of that into us, and then we can take care of that for you. And then this last one is one that folks might get, which is the Social Security Administration COLA adjustment letter. And this letter also will come through with those items that we need to see, letting us know that your Medicare costs have a monthly amount of X. And then also, of course, if you have any like Medicare Part D payments and effective dates in your name, right? That's all going to show on this document. All right, so the last thing that I want to make everyone aware of course, this is a no-brainer. Our team is here to help you. So if you have questions, you need help submitting documents, or you just want to confirm your benefits and kind of see where you are, get the lay of the land, please reach out. We're available Monday through Friday, 8 a.m. to 5 p.m. Pacific time. You can email us, you can call us, you can visit the website if you want to hunt around on your own and do whatever works best for you. We're here, my team, your union, all of us are here to make sure you and your family stay covered and to ensure that you all stay supported and healthy. So with that, we will go ahead and wrap up the formal part of today's session. And I want to thank you very much for joining us and staying engaged. I keep saying there's a pop-up of tons of questions, so I know y'all have questions. So now we'll open it up for questions. Again, I just want to reiterate that if you have a specific issue or question, please send a message in the chat to panelists. If you can do a specific panelist, Anna Lilia or Lily is the one you want to send your case specific question to, and she will ensure that you get an answer no later than the end of next week, just because we want to be able to get to everybody in case we have quite a few. And with that, I would love to start by first questioning my panelists and asking, are there any questions that we need to answer out loud before we let folks come off mute and ask questions?
Yeah, there are some great questions. Hi, everyone. These are common questions that have been coming up quite a bit on the chat and on the Q&A. First question, Marche, what do I do if I do not have a health plan, if I do not have health insurance?
Oh, great question. So, two things. One thing is if you are a childcare provider, you don't have health insurance currently, first, still do an application with us because we can still get you started and access to those core benefits that we talked about. So you're not missing out while we get the other stuff squared away. And then in terms of getting you into the reimbursement portion of the program, what you'll want to do, so there's sort of two things you can do. You can reach out to us and we can send your information over to one of our broker partners to reach out, or you can also visit our website, and we actually have a list of brokers. You can take a pick of your choice, right? So they list their languages. They list sort of what their specialties are, right? Some of them are great with Medicare scenarios. Some of them are excellent with Covered California. You can have your pick of the litter. But yes, you do have those two options. Not having healthcare coverage today is not a barrier for you being able to partake in the reimbursement program benefits tomorrow. So if you currently don't have coverage, you want to reach out to us to let us know, and we can try to help get you partnered with a broker. Or you can self-serve if that's your desire and just visit our website and go to and y'all will have to keep me honest because I don't have the website up. But there's a section regarding health insurance and how to get you in touch with a broker.
Yeah, we dropped it on the chat on our website. If you go under about the program and health plan enrollment, you'll be able to find the list of brokers. And I put the link directly on the chat so you can find it there.
Excellent. Thank you, Lily.
Yeah, another great question. Do I have to apply for the healthcare fund every year?
Excellent question. Please do not. If you apply multiple times, it'll just duplicate you in our system. The great thing again about this program is you do one application one time and we have you. So no, you are not required to reapply ever once you apply the first time. If for some reason you lose eligibility, we're going to keep looking at you on a routine basis until we get you back into the program. there will be no reason or instance where you actually have to go in and redo an application. So no, providers do not need to reapply every year. Once you're in our system, you're in our system. If you continue to meet our eligibility requirements, you will continue to have benefits. So no need to reapply, honestly, in any scenario.
Thank you. That's a good segue to go to the next question that came up quite a lot. What are the requirements? What do I need to do in order to be eligible?
So you'll remember in like the first few slides that we looked at, there were those two things, right? It used to be three things, now it's two. So you have to be paid for working with the state subsidized child. And depending on when you apply, there's a specific what we call a look back period. And so starting in January, on January 1st in January and into 2026, it will now evaluate, right? When you apply, does the provider have at least three payments, or I should say 3 months of payments for working with a child that has subsidized payments for 3 months out of a 12-month period. So what that means is you only need one payment, right? So if you only have one on your roster, that's all you need. And you just have to have been paid 3 separate months out of a 12-month look back period to be eligible. So depending on when you apply will dictate what your look back period is. And we can, again, that might be a little case specific because we'll have to actually go back and take a look if you have questions on what your look back period is or was. But the only thing that you need to do, everybody, as of January 1st, is three payments and the look back period's 12 months and an application. It's that simple. It sounds too good to be true, but that is the criteria. Subsidized payments for 3 months out of 12 and an application gets you into the healthcare fund.
Thank you so much, Marche. Those were the most common questions tonight.
I had another one that came up a lot, and that is
Sure.
family coverage.
Mm,
A lot of the providers are asking if their dependents, their spouse, what is covered, how can they qualify, how can they add them? Um, so yeah, having to explain the family aspect of adding them to the fund.
okay, excellent. Yep, let me do this. I'm going to get a little creative on everybody. Let me stop sharing. And I'm going to pull up the website and reshare. And let's walk through it. All right, let me reshare, ladies and gentlemen. All right. All right, you guys let me know when you can see my screen. Can you see it?
We can see it.
Oh, excellent. All right, you'll see our wonderful homepage with Alicia Turner, who's a child care provider. Okay, let's talk about family benefits. So first on our website, we do have quite a bit of information about all of the different nuances of the healthcare fund's benefits. If you want to just kind of know about the program, again, what's eligibility all about? How do I apply? That's that. If I'm not insured, what do I do? This is this section. But let's talk about dependent or family coverage. So when we talk about dependents, right, we're really talking about eligible family members, right? And so for this program, it's going to be your spouse and any children that you have that are under the age of 26. And if you have a child that is under your care who's over 26, then they must be like an overage disabled dependent. Those are essentially the folks that you can add to your family benefits. So you can't just say, hey, I have my cousin living with me, right? Can I add them? Unfortunately, they would not be considered an eligible dependent or family member, so they wouldn't be actually eligible to be added to this. So again, there's additional information on here about providers who are enrolled in the program wanting to add their dependents, and what dependents are eligible. And on this page, you'll also come across what we call a dependent application, or sometimes we refer to it as like an application addendum. So if you are a provider who is already in the fund and you're like, hey, I want to add my husband because, again, it'll beef up your benefits. It'll give you access to additional funds to help pay for your spouse's costs as well. Or it'll give your spouse access, right, to your um, um, dental and vision, right? That's again free of charge, right? We'll extend those benefits to your spouse. We'll extend the provider assistance program resources and so on and so forth. You would literally just have to do this application. So just opening it really quick, that way everybody kind of gets a look at it, right? So this form is one that we created this year. It gives first page is going to give you all the stuff you need to know about sending the form back in so that we can process it and add your family member. Um, First section is going to be just your information. That way we make sure that we're updating the correct provider information in the system. That you're going to have to just submit for your whoever you're adding, right? Spouse or child. Section B is the important section, right? This is where providers go to know what do I submit as proof so that I can add my family member to my healthcare fund account and we can get those benefits accessed by my dependents, right? So for depending on who you're adding, right? If it's your spouse or child, the best thing that you can submit that'll one and done it is going to be a copy of your health plan information that shows all of you on the same plan. So for us, that will essentially cover all the bases about who we're adding, who's eligible, the costs, so that we know how much money you may need for additional premium payments and that sort of thing. And it, and so on and so forth. If you're a provider who has, like, let's say you are within Medicare age, right? So we all know once you hit like Medicare age, you can't have family members follow you onto Medicare, right? So those scenarios we typically see, provider might be on Medicare, maybe the husband or the wife in this scenario is on an employer plan or a covered California plan, or maybe even a Medi-Cal plan, right? So provider will want to look at this section because it's going to give them guidance since they're not on the same plan on what to submit so that we can add their family member. So here's the form that you need to fill out. You're going to initial and sign and actually get that back into us. We also have some additional information about, just what are the things that our family gets, right? So if I actually add people and do the work to send in documentation, you want to go over to benefits on the website, over to family coverage, and we're going to it talks to you a little bit about what those benefits are. So just to give you an example, if you are a provider who has covered California and you're adding your family members who have covered California as well, right? This is what it'll get you, right? So number one, our providers with covered California are going to get their premium reimbursement, right? For their provider portion. We'll take care of that 100%. And then, we're also going to give you an additional $200 for your family member. If you're adding more than one family member, then we're going to, again, pay your entire provider portion of your premium, but we're also going to give you an extra $400 to apply for your remaining family members' premium portion. And then in addition to that, instead of you getting that $94.50 for out of pocket, right, to be able to pay for co-pays, prescriptions, and things like that, we're going to beef that up and double it and give you $18,900. Right? So this page is really going to kind of outline for you, depending on the health plan that you're on with your family member, what your additional benefits will be under that family plan. Okay. And again, it's going to give you information on how to add your family, right? So if you land here, the forms are here as well about adding your dependent, both in English and in Spanish. And then again, if you're a provider who has what we call a split household, and I think Covered California can refer to it as like a mixed household. There's just some information in this section about what to do if you are a mixed household provider. Because again, you'll have to just do a little bit more documentation because it won't be one document for everybody. All right. Does that kind of answer the question, Lupe? Okay. Any
Yes,
other?
thank you.
Yeah, no, great. This is great. I'm glad we got to pull up the website. Any other questions that you all saw before we open it up for the providers? All right. So let me stop sharing so I can get back and see the Zoom so I can see who might have their hand up. I do actually see a really good question that just is at the bottom. I'm just going to answer it out loud because this is one that we get quite often as well. Is do these benefits extend past the provider and their family to like assistants or staff at some of our daycare centers? The current answer is no. We have not yet opened this benefit up to staff members working for childcare providers or in their centers. But it is something that has been noted so that the board is aware that this is a hot topic now that we've rolled out family benefits. And I'll say more to come. We'll see the new the new year and the program brings. All right, so let me go over to. So first, if you don't have a question, put your hand down. That way I call call on the right people. So I'm just going to start at the top of the list. Looks like we have like 14-ish people. Let's start with Miss Rowena Martinez. Oh, let me help you. All right.
Are you,
Rowena,
am I there? Can
yeah,
you hear
we
me?
can hear you.
Okay, perfect. It looks like I had the same question someone else had, so sorry about that. But is there a cost and I have to go through the local union to see who I'm with? And is there a cost to be a member every month? Is it yearly? Do you know?
Okay, so the healthcare fund is completely free for
Separate.
childcare providers.
Okay,
So to do an application and take advantage of the things that I've covered for everybody today, there is
uh-huh.
absolutely no charge. Um,
Perfect.
what I will point out though, Rowena, is that if you get into the fund and you do want to actually purchase additional life insurance, and that's that voluntary plan I mentioned, you have the option if you choose to actually purchase additional coverage, but it's optional. There is
Okay.
no fee to take part in this. There's no cost associated to being a healthcare fund recipient or member. And there are no costs to you to get the benefits that we offer, except for the one, and that's optional. So free dental and vision, free provider resource, provider assistance program benefits, free life insurance, right? We do have that basic life
Yeah,
insurance policy that all providers get. It's $50,000 across the board, doesn't cost you a penny. You simply get it for being a part of the healthcare fund and being a childcare provider.
so
Um,
you're saying Merry Christmas?
yeah, yes, for the past 3 years, Merry Christmas and spread the word. Yes, yes,
Okay,
yes, yes.
thank you.
Yes,
Thank
ma'am.
you.
The one thing, the caveat that I'll mention, because I don't want us to conflate the things, is that joining the healthcare fund is not the same as joining and participating in your local union. It's our desire that our providers do both. And
Oh,
I'm
I
not
see.
sure if there's somebody here, if it's, Connie or anybody that might want to speak to, potential dues that providers may have if they also join CCPU, which we really, really, really encourage everybody to do because that's how we keep these amazing benefits and grow them. There may be, like a dues that you pay for that, but that is not a charge that you need to pay in order to get these benefits.
Perfect.
I can speak to
Thank
the
you.
union dues question, Marche.
Excellent. I need an expert.
Okay.
Hi, Rowena. That's a great
Hi,
question.
thank you.
Of course. I know a lot of people have asked about that tonight, and so I just wanted to make it very clear. Union dues are a small percentage of what you are paid for your subsidized care, and that is 2% of your subsidy payments. That is equivalent to about $10 for every $500 that you are paid from the state. And it would not exceed $90 a month, regardless of how much you actually earn through subsidized care. If it exceeded that amount, right? We capped that at 90%. So that is the due structure for all CCPU members.
Perfect. Thank you. Thank you
Yes.
for the clarification. Thanks.
You got it. And okay. The next one we'll take is Miss Heidi Escobar Rocha. I'm gonna go ahead and take you off mute.
Hi, thank you for tonight's information. When
Mhm.
you were breaking down right now the payments, when you said covered California, let's say I get coverage, medical coverage through my husband's employer.
Uh-huh.
When you say provider premium, that's just a 200 for us. That's a given, just for the providers, right?
Okay, so let's take a step back. So if you're on your husband's, like, are you saying like employer sponsored?
Yes.
Gotcha. So yes. So what happens with employer sponsored is if you're on employer sponsored, the healthcare fund will give you $200 towards whatever premium your husband is paying out of his paycheck to, cover
Huh?
you. If you add your husband to your CCPU healthcare fund account with us, we will also give you money to pay for your husband's portion of his premium. So let's say, you have a family of
Three.
three. There you go. We got a family of three, and you're paying 1,000. I'm just putting this like round number.
I'm going to round it up for you like $430 monthly, $220 biweekly.
In your scenario, this fund would pay 100% of that
Okay. So I
because
just received my reimbursement
Mhm.
and um they just kept saying there's a cap based on dependence.
There
So
is.
and that's what I wanted to know because right now when you're saying there's a like they'll
Uh-huh.
pay your full premium, if it exceeds the 400, then that would be the out of pocket we would have to pay. Or like we would
So
have to eat in a sense.
Right. So in your scenario, because you're on employer sponsored, the only plan that we have that we will pay 100% of your provider portion of a premium is Covered California.
Ah, I
And
see.
it's only the provider portion, right? So if you have dependents on Covered California, we don't pay 100% of their portion, just yours. But in the scenario of employer sponsored coverage, we're going to give the $200 for you. If you have your husband added, that's $200 for him. And let me just make sure I'm not getting this mixed up with another benefit, y'all, because we got quite a few.
And I have a 15-month-old, but it doesn't matter the age. I'm just saying
Does
we're a
not matter
family of
the
three.
age. Yep. So let me just really quick share with you one more time. That way we all see the same thing, everybody.
I think when I submit my claims, I make the math, right? Or I submit my proof, it always either gets denied and then it gets kind of like they add it up in a sense, and then I get like their payment history, and I'm just like wondering, okay, right now that you kind of broke it down, I'm like, is it being paid out right, or am I misunderstanding what we're
So yeah, so number one, we'll have Lily actually take your name down and we're going to research this one. But in this scenario, Heidi, if you are on an employer sponsored with your husband, for
Mhm.
you, you're going to get up to $200. And because you said you have like two family members that you're adding, not just one, you would get an additional put up to $400 for premium reimbursement. But
But
remember,
that's
it's up
up
to.
to. But the 200 is a guarantee. The other is the option
The
of the up.
so in your scenario, you would potentially get $600 unless your monthly insurance payment is less than that.
It is less. It's for something. So it's just
Right.
one.
So in your scenario, it should cover everything. My question is, have you added the baby?
Yes.
Okay, so then that's definitely something we need to research because it just might be that we need to update your money in your reimbursement portal.
Okay, because
We can take a look.
yeah, if anyone can grab my name and number, that would be great. Because I just received it, and I'm not trying to be sound ungrateful. It was a really nice chunk of change. But then when we're making the math, I'm like, am I off? Or do they think it's only $218 monthly when it's bi-weekly that they take from him? So I'm just like,
Ah, that could be it too. If they think if
yeah.
it wasn't
I'm
clear
like,
to us
I
that
wish he wishes, but that's not the case. And that's where I'm just like, right now, when I kind of heard you break it down, I was like, did you listen to that? Is it just me? I'm like, just let me ask this question because it's been something that's been bugging us. And I'm just like, I wonder, like how they break it down. And my dad's another one. My mom's a provider. My dad's finally added him on, and they pay about 375 a month, but unfortunately here in California your hearing premiums are going to go up, and he hasn't gotten his open enrollment yet, and my mom's like, well, I can't help you past 400 because that's what they're
right,
capping them. But that's something, that's a lot. And and that's if my dad drops the vision and dental, then he probably hopefully pays less, and it falls in the premium of what we're being reimbursed, which is, like I said, it's a lot of money compared to not getting anything.
right.
Okay.
Okay, so yeah, Lily, go ahead and take Heidi's name down and we'll look into it and we'll reach back out to you to get
Perfect.
it.
Great.
Thank you.
Yep. Take it down. Thank you, Heidi.
Thank you.
Oh, thank you, thank you. All right, so let me hop on over to, let's see, who's our next person? I have Keisha Divine.
Hi, sorry, my background's a little loud. I
That's
just
okay.
wanted to confirm if you guys will be covering like occupational therapy, speech therapy, vision therapy, things that are covered by insurance but aren't necessarily like medical, I guess.
So the way that so depending on what health plan you're on, this benefit will cover anything that your health insurance pays a portion of. So let me give you an example. This is my favorite example to tell people. We had a provider who has diabetes, right? And so she says, Marche, I went to my doctor, I diagnosed with diabetes, it's out of control. So they sent me to a nutritionist. Nutritionist, is giving me all these things to do to help, manage my diabetes so I can, do better. It's like, okay, cool. She said, but my nutritionist is telling me that like I need to go, change my diet. I got to buy certain foods. And Marche, groceries are expensive. And if they're healthy, they're real expensive. She's like, so will this program pay for or help me pay for those healthy groceries since technically, right, my doctor is prescribing me a certain food to eat for my medical condition. And I said, this program will help you pay for your groceries if your health insurance is covering part of the apple. So what we have to remember, everybody, for the reimbursement program is that this program is only going to support items or charges or services that your health insurance pays a portion of. Even if your doctor is prescribing you or sending you somewhere for a certain treatment, right? Because we like, for instance, we're all stressed out, right? So, my doctor is like, Marche, you need to go take vacation. I'm prescribing you vacation. My health insurance doesn't care, right? Health insurance is not going to pay for my trip to Fiji. Right? So what we want to remember, Keisha, is whatever you're wanting to use your debit card for has to be something that your health insurance is paying a portion of. Those are the charges that you can submit to us, and we'll either reimburse you for whatever part you had to pay, or you can swipe our card, just submit the receipt and we'll cover it. Does that help?
That does. Thank you so much.
Yes, ma'am. All right, next question. I think I have Denisha Williams.
Hi. Excuse me. That was one of my questions.
Mhm,
Um, I've been a provider for a while. I
mhm.
mean, I've been a part of the program for a while, and I didn't know that if I lost my receipt, that they froze my account.
Mhm, mhm.
So how can I fix that? Or is it a way to fix it?
So there are a couple ways. So How long
Uh,
ago? How long ago?
it happened in I think April.
Oh, okay. So this year.
Yes.
Okay, so the documentation that you misplaced, is it like if you don't mind me asking, are you like on a Medi-Cal plan or are you on a like
Yeah,
a
the Medi-Cal plan.
okay, what is it like like I went to Walgreens and bought aspirin kind of thing, or was it like I actually went and purchased like my medication or something?
Well, it was like some aspirins. It was like for $7, and I ended up throwing it away. And
Mm.
then, well, I thought I threw it away, but I finally found it. But it was no way to add it to the website anymore because it's
Okay,
frozen.
excellent. Got it. Okay, so
Okay.
if you found it, you can email it to us and we'll
Um,
get it and we'll
got
clear
Uber?
that charge.
Okay.
Okay. Be careful.
The other thing, so if that were not the case though, if that were not the case, what we would do for that is that you would have had to repay the $7 so that we clear the claim and then we would reactivate your debit card. So that's a
Okay.
prime example of why we say everybody, there's nothing I can do if you lose a receipt. So so try your darndest. A good practice, everybody, at least one that I've seen and other providers have kind of that we've talked to have gotten accustomed to is swipe the card, take a picture.
Oh, okay.
Just that way, if you lose it, you lose it, but you still have it digitally, and then you can just email it to us.
Okay. Um, can you put the email in the comments or in the chat?
Absolutely. We'll have someone from the team will drop the link to the email for sure. Yes,
Okay.
ma'am.
Oh, and one other question.
Hmm.
So my daughter is with the in-home care department,
Hmm.
and I know it's connected to the union. So
Hmm.
do she get the same benefit as I am? Because she's in the union, but she's not taking part of any of the things
Child care.
right. And she's
Okay.
not she just pay her union dues. She don't do anything else because she didn't know if she qualified for any benefits.
Okay. So in your daughter's scenario, she would not be eligible for healthcare fund benefits because these are only for child care providers.
Okay.
So now
O-
you got to pull her over to our side.
Okay. So
Okay.
is it only for childcare? Gotcha.
You got it.
Okay, that's it. Thank you so much.
You're very, very welcome. All right. So I know we're over. Was somebody saying something? Okay. If I'm okay to answer a few more to see how many we can get through and stay a little bit after everybody, if that's okay with you all. So the next person I have on the list is Eladia Gerardo. Jurado.
Okay. Yes. Hello, can you hear me?
I can. Hi there.
Hi. Okay. So I am actually Eladia's daughter. I'm helping her because she's Spanish speaking. So
Okay.
I've been trying to help her translate, but I got here a little bit late, so I do have a few little brief questions
Okay.
that she had been asking me. Um, I mean, if you could put it in the chat, the website to add a family member, if I can get that, please, to help her out,
Yep.
that would be great. And then also, she was mentioning to me because she's on Medicare, um, pays her, I guess her premium goes through Social Security or something like that. But she was explaining to me that unfortunately, she called Social Security and was told that she could not use that benefit card to pay her premium to keep her coverage.
Okay.
And I guess it was due to it being an auto payment. So she
Oh,
was asking me if she can get an itemized receipt from them, can she submit it for reimbursement or how can she go around having this card cover for her?
That is exactly what she would want to do. So providers have the two options on how to, well, in this scenario, right? She have two options on how to use her benefit. Since they're not allowing her to just pay with her debit card and not have to worry about paying out of pocket, that would be the route that she's going to want to take. She's going to want to pay it out of pocket and then just submit a request to us to reimburse her. The great thing, everybody, about your premium is that typically your premium is not going to change the entire year, right? So when you provide us your proof of coverage and we see what your premium is, we enter that into our system. It makes it so that we don't require you to submit proof of premium every month if you need to have it reimbursed. So in your mom's scenario, since she's having to pay out of pocket, all she would have to do is send us an email and just say, I'm requesting my premium reimbursement for, this month or the months that have passed or whatever the time period is. And we'll process it. And then if she has direct deposit set up, we'll send her a direct deposit for the amount to reimburse her for it. Or we can cut a check if she doesn't like direct deposit and we can stick it in the mail for her every time she needs it reimbursed.
Okay, great. That's great. I will go
Yes,
ahead
ma'am.
and give her that information. Also, I was trying to help her set up her registration on the CCPU website.
Mhm.
However, I was a little confused because on one portion it was saying that she was active, but it didn't show like no benefits or amounts or like what she can do, what she can use her benefits for. And then on another portion of it, it seemed like her application was still being processed. So how can I help her find out if she's covered or not or approved for the program?
Yep. So typically, just giving us a call, we can always check that and walk her through. But because you've got us tonight, I'm going to ask, I'm sure Lily's already written her down. We can contact mom, and if there's a good time where maybe you'll be there if you want to just support her and help out, we can absolutely reach out to you or her or the both of you, and we can figure that all out for you.
Eladia,
Okay.
if you don't mind, your mom's name one more time.
Eladia Jurado.
Okay. Oh, that is your mom. Okay.
Yes.
Very well. Thank you.
Yep. And if you want to also drop your name into the chat, that way Lily writes it down. And if you want to just provide us if there's like a best time, if you want to be there so that she's not taking the call from, Lily or one of the staff members alone, just let us know and we can get that going for you.
Oh, of course. Yeah. I mean, and if it's easier, I mean, I don't mind you guys reaching out, calling me, if anything, so I can help her out. I know sometimes I'm leaving work, so she's at home.
Okay.
So it makes it a little difficult with the schedules, but I don't mind either providing my phone number if that's okay with you guys communicating with me to help her out. That would be great.
Yep. We'll reach out. You
Perfect.
got it.
And then I had one more question,
Yeah.
because she was asking me as well, how the card kind of works. And I believe I might have this question already answered. But for example, my mom and my father suffer from back pain.
Mhm.
And sometimes they're like in need of, like, say, like the lidocaine patches or a muscle stimulator or like one of those handheld massagers. For
Mhm.
that to be covered under the card, um, how can they go about using that? Would they need like an insurance authorization saying, yes, we'll cover it, but this is your portion? Or is
Mhm.
it something that they can go, say, for example, to CVS? Because you can find those in CVS a lot nowadays
Yes.
and purchase it
Yep.
that way.
Yeah, so if your mom is on Medicare, she would not be able to purchase like, that equipment like at CVS with her card. It would have to be purchased where the insurance does pay a portion. So like if her doctor for her back, chronic back pain is saying, hey, I'm gonna prescribe you a, muscle massager, and then your insurance says, okay, well, I'll pay, 30% of it, right?
Mm-hmm.
And then, you just have to pay the remaining portion. If they do that, that's what you would submit to us. Now, if your insurance pays nothing, this program pays nothing.
I see. I
Yep,
see. Okay.
yep, yep.
Okay, perfect. Well, I think that's all the questions I have. ¿Tiene otra pregunta más?
No, es todo.
Okay.
Es todo.
Okay, thank you. Sorry.
No, that's
No, I
okay.
think we're good. We're good to go. Thank you so much. I appreciate you guys. She appreciates all the help.
You're most welcome. Okay, next person I have is
Marche.
LaDonna Clark. Oh, go ahead, Lily.
Before we move on, this question keeps on coming up quite a bit, and I just want you to answer it for us, if you
Okay.
will. It's about dental expenses. Can I use the debit card to pay for my dental expenses? It's came up quite a bit.
Okay, that's a great, great question. So, there's a two-part answer. So, with our dental expenses, it's going to depend on what qualified health plan you're on. If you are on Medi-Cal, or Medi-Medi, which is the Medi-Cal and Medicare combined, you actually can then use your permissible benefit to help pay for dental costs. If you are a provider who is on like Covered California, employer sponsored, Medicare, veterans, TRICARE, any of the other qualified health plans, then you would not be able to use your reimbursement card for any charge or any service that is not medical. So what that means is if you go, get braces, you cannot swipe your card to help pay for it. If you need to go buy glasses, you cannot swipe this card to go pay for it. But what the great thing is that because this benefit also offers you free dental and vision, we have pretty great dental and vision coverage that pays almost 100% of the majority of the things that you would want for dental and vision. So if you, need to go pick up glasses, there's a use our insurance, go see physician, an optometrist, pick classes, and then you can purchase them there, and you have a frames allowance and things like that. But if you actually don't have Medi-Cal or Medi-Medi, you are not able to use your healthcare reimbursement card to help pay for dental or vision costs. Okay, Miss LaDonna Clark. I think it's
Hi, thank you so much. This has
uh-huh.
been great information. I really appreciate it. I
You're
have
welcome.
my question is this. When I first signed up, I think I've been a part of the program for the reimbursement program for a year now. Um, I was told that in order to stay eligible, you have to provide care for the subsidized child within those months. They broke them down. Let me
Mhm.
see.
Certain
You,
months. Yep.
right. Uh-huh. And so it said provide care for them. So this last time I turned in my proof of, that I had cared for my subsidized child within that month.
Mhm.
But the program that or the people that pay me for the care, they don't pay you until the month after. So it's
Mhm.
like I provide care in June, I turn in the timesheet on the last day of June, and then they cut a check and it doesn't come until like July 7th or whatever the payday is. So because the pay stub said
Mhm.
July, it made me not qualify. And I got kicked out of the program. I mean, my benefits stopped. And I was like, whoa, whoa, whoa. That's not what
Mhm.
it said. So I just need some clarification.
Mhm.
Um, date of care versus when they send me that check.
Yeah, so we've had a few providers along the way that have had a similar situation to yours, LaDonna. And
Mm-hmm.
the rule of the program, and again, this is set by the Board of Trustees, is not set by me
Mm-hmm.
or any of the staff that you've probably spoken or engaged with. But the rule states that we count the payments in the month they are paid. not the month that the services are actually rendered. We've had like I said, a few providers along the way because some of them end up with even months that go into one payment, and we can only
Mhm.
count multiple months of work as 1 month because they only got paid for it in the 1 month. So in your scenario, if you did the care, for instance, like you said in June, and they paid you in July, then we have to, by the rules of this program, count it as July.
Right. Okay. Um, all right. Yeah, that's kind of yeah, I don't know. It's a little misleading because from, the information talking to some of the people that I talked to on the phone when I first started, that was my understanding that you had to provide the care within the month. And then also on your website it says, for ongoing eligibility
Mhm.
period for 1 of 3 months of work with the subsidized child. So it doesn't say you have to get paid. It says you have to work with them during those months. So it's a little
Misleading.
confusing. And so yeah.
Thank you for actually pointing that out, because
Mm-hmm.
that's an update that we can make to the language to make it ever clear on what
Mm-hmm.
the rule is.
Mm-hmm.
But yeah, in this scenario, it would be what they advise in terms of we only count that month that you were actually paid.
Okay.
But I will tell you again, y'all, as we continue to voice, the feedback that we're hearing from providers to the board, that's not to say that this is not something that will change in the future or even
Mm-hmm.
near future.
Okay, and then I have one other question,
Mhm,
and that is, so I unfortunately lost my coverage. I was sent a package from you guys about getting on Cobra or something else,
mhm,
but I'm not going to do that. So then my new benefit. So for this last pay, I mean for this last quarter, I
mhm.
lost my benefits. So um, I um, I'm in remission from colon cancer, so I have a lot of medication that I take, and so I use the reimbursement card to pick up my medication, and it averages about, I don't know, almost $200 a month worth of medications that I take. If I've used my card since y'all said you're not eligible anymore, am I have to pay that back?
So first, if you, the card shouldn't work if you're no longer
Oh, okay,
eligible.
okay,
So, if you were able to swipe
mm,
the card and it worked, you should still be okay.
okay,
But LaDonna, that's something that we might want to check into for you and get back to just to make sure that what we show in the system for you is
hmm,
what your understanding is about your current eligibility.
okay, all right.
Let us take a
Yeah.
look at that and reach back out.
Okay, that would be wonderful because
Of
I'm
course.
just I'm all confused. I'm such a my OCD, like I'm telling I was like, what do you mean I got it wrong? I got to get 100% on the test and everything. I'm like, what do you mean I got it wrong?
She was like, I'm an
Anyway, thank you
overachiever
so
and I
much.
studied.
Yes, right. Yes, ma'am. I read every line. Anyway, thank you so much. And this has been wonderful. And I so appreciate being a part of this whole movement. Like I've been a teacher for 23 years. I've been doing childcare for the last 4. Like this has been wonderful. You guys are great and I appreciate you.
Thank you, Miss LaDonna. You have a great night, and we really appreciate the kind words.
Yeah. Okay. Thank you.
Thank you, you too.
Okay. Bye-bye.
Um, bye-bye. Okay, everyone, we're almost at 8 o'clock. I'm gonna take two more questions. And if you have a burning question that has not been answered or you don't get called on, please stick your question in the chat and we can try to follow up with you after this. And if you are one of the folks that still has a hand up, and your question is your case specific, send that to Lily or Anna Lilia. And again, we'll reach out. That way we can do some research into your specific case and be able to give you the appropriate level of assistance. All right, so the next person on my list, sorry y'all, no particular order. I'm showing Julia Umana.
Hello.
Hello.
Yeah, I have uh, uh, applied and registered and approved. And I went to the last meeting. They told me to go over there, bring all my documents so that you guys can help me out. I went, no one was able to help me. So and the card that you guys are talking about, I have not received it. And also, how do I get, I know the meeting have been about how to get a reimbursement, but it's there actually someone who will be able to help me out because I brought all my documents, receipts. They told me to bring everything I had, the 1095, and no one was able to help me when I went to the meeting. I forgot what it was. I think it was somewhere in Pasadena, I believe.
Okay. So yeah, if you brought your documents and you still haven't like gotten a enrollment, anything on your enrollment or what the status is or a debit card, if we actually were able to approve you, we want to follow up with you, Julia. So
Okay.
let's make sure we get your information over to Lily. That way we can again do some research
Hmm.
and reach out to you so that we can get you going.
Okay, thank you.
Yes, ma'am. Thank you for letting us know.
All right.
All
Julia, I
right.
have a question for you. Have
Sure.
you already submitted the application you said?
Yes.
Okay. And is Umana the last name you used?
Yes, Humana.
Okay. All right, perfect. Okay, thank you. I found your information, so we will definitely get in contact with you tomorrow.
Okay, thank you so much.
Thank you.
Bye-bye.
All right, the next person on my list, again, no particular order, everybody, is Desiree Cannon.
Hello, thank you so much. I really appreciate it. So I do have a couple questions. So earlier someone had mentioned about how, because like for me, I'm a provider and then I added my husband and my three children onto the program. And so like I saw for the reimbursement for the premiums, it's quarterly. So I know that you said it was $200 that because I have insurance through my husband's employer. So
Mm-hmm,
it's $200 reimbursement for me and then up to $400 for my dependent. So that could potentially be a reimbursement of $600 a month, correct?
mm-hmm,
So like for mine, my husband, well, we pay $126 every week. So depending on if there's 4 Fridays or 5 Fridays in the month, we pay anywhere between a little over 500 to about $620. But my reimbursement quarterly is 1298. So that's like $430 per month that it says that we do pay, but we actually pay more than that. So
mm-hmm.
I just wasn't sure if that's something that can be checked into. Um,
Absolutely.
yeah, and then go ahead, sorry.
Yep, just to call that out because you're not a provider that has a like a set either bi-weekly or weekly kind of structured premium payment that's being paid. It's going based off sort of like the calendar days in the month, in terms of what you get charged for health insurance in that month. You have what we would basically call like an abnormal, uh, premium payment schedule. So the
Yeah,
way that
yeah,
our
he gets paid every Friday. So some months there's 4 Fridays and
for
other months there's,
five,
five
mhm.
Fridays.
Nope, I totally get it.
Oh,
So
okay.
just to kind of give you just a little information and then what we can do about that is the way that our system's built, it's built just to input one number, which is what is your premium per month.
Okay.
But because yours fluctuates, right? It goes up and down. We could only put the one amount into the system in order to load it into your account. So
Mm-hmm.
for you, what we'll probably have to do, Desiree, is we'll probably have to do what we kind of call like a manual adjustment for you on the
Uh-huh.
months that your premium is more than the four Fridays, if it's 5 Fridays. But what
Yeah.
that's gonna unfortunately what that's gonna and we can absolutely do it, no problem. But what it's gonna require from you is just a little extra engagement with us so that
Mm-hmm.
you're notifying us in the months that there are 5 payments. With like a paid stub that's showing that extra fifth payment for that month, and then we can just make the manual adjustment and then issue the reimbursement.
Yeah. Well, what I was trying to say is because like the quarterly, it's $1,298 for every 3 months, so that's like $432 a month. that it's calculating. But for, us, even if there's only 4 Fridays, we pay $504 for that month. But if there's 5 Fridays, and we're paying like $626. So like it's still less than what we are actually paying. So that's what I was just curious about.
Yeah, so again, this will be a case we want to take back and research to figure out if it's just whatever information we have, it wasn't clear that these are weekly payments. They might have thought it
Okay.
was like bi-weekly.
Okay.
Um,
Okay.
so yeah, we want to take that back and take a look. And then, like I said, we can reach out to you, do a little research, reach out, and then we'll get you square.
Okay, yeah. And then the second question is, because I know someone that, came on to ask the question, or I'm sorry, back track. So earlier in the presentation, you had mentioned that instead of you guys having to look at every, quarter to see if we're still eligible,
Mhm,
we just have to do eligibility once a year.
mhm.
So when we submit to show that we're going to have coverage for, 2026,
Yep.
do we also have to submit still quarterly for the premium reimbursement, or is it just once a year?
Great question, because this is something we just discussed in operations about how we're gonna how premiums will actually be accessed. Let's see, please keep me honest. I think the decision was we're gonna continue quarterly.
Okay.
That's right.
And we're doing it sort of that way because there are still scenarios where providers might have a change in premium or a change in their health plan. And we want to be able to make that pivot quickly for you and not have to go back, recalculate, figure out if we overpaid you or underpaid you. We want to make sure that we're making that change as quickly as we can to make sure that you're having the reimbursement benefits that you need to pay your premiums.
Okay. Okay.
Yes, ma'am. All right. I'm gonna take one more, everybody, and then I'm gonna have to cut it off. Let's do Maria Cisneros. Are you there, Maria?
Hello?
Hi, hello there.
Hi. Okay. My question is, I already applied for my husband. It's just me and my husband.
Hmm.
He's getting Medicare already by the Social Security.
Okay.
And I send it to the Social Security so he could get approved to send it to you guys. How much he paid, they take it away from his check every month.
Hmm.
But they told him they can't give it that proof. So what do I do?
I want to make sure that I'm hearing you correctly, Maria. The connection might be a little fuzzy. So you have benefits with us, and you added your husband. He has
Yes,
Medicare. You
yes,
sent in documentation, and you reached out to Social Security because his payments for his Medicare are coming out of his Social Security every month.
yes, yes,
And Social Security advised that they cannot provide you anything for proof that those payments are coming out.
yes.
I've never had this scenario that he's
The,
only.
the only proof we have is that because he has an automatic uh, withdrawal to his bank account. So that's the only proof I have.
So I just want to make sure he hasn't received any of these documents concerning his Medicare.
No, no. That's why I asked that question right now because I'm looking all those documents and I already take a screenshot so I could print it out and take it to the Social Security. But in case that they don't want to give it to him, what do I do?
I'm not sure. Unfortunately, we're not on the side of getting the proof giving, so I can't.
Uh-huh.
I'm just the recipient of what you give, what you are able to provide me. I'm not
Yes,
sure that I have an answer, but if Social Security is debiting an amount from his Social Security payment, They
Yes.
have to be able to provide something that at least lets him know, like, this is your Social Security that you're going to get every month, and this is the amount that we're going to take out every month for his Medicare.
Okay. Okay. Maybe because he went by himself and he's very self. So I think I need to go in person then with them.
Probably.
Okay.
Wives and
Okay.
husbands, right?
Oh, yes, yes. The other question is when they already approve them, like a part of the health fund, are he's gonna get a different Visa card or he's gonna be using the one I have already?
Yes, it'll be the same one. There's only one it's issued per family, and it'll just be the
Uh-huh.
same card. We'll just give you more benefits with the card.
Okay, okay. So, for example, when you guys approve him, if he ended in the hospital, I could pay the difference. Whatever Medicare don't pay, I could pay it with that card. It doesn't
You
matter
got it.
that it says Maria Cisneros.
That's absolutely right, because in our system, we will show that he's a part of your family and we'll accept that charge.
Okay, thank you so much.
You are very welcome, Maria.
Okay, bye-bye.
Bye-bye now. All
Okay.
right, everybody. Hopefully, because we didn't get a chance to answer every single question for people that had their hands up, please, like I said, enter your question into the chat and we'll try to reach back out to you. And it may be via email for some of the questions. So please keep an eye out from your email in case we do have to respond to you via that. And then for the ones that are provider specific that are, involve us having to do a little research into your case, the team will reach out typically by phone to go ahead and actually get you your resolution. I want to thank everybody for coming tonight. I want to give Connie, I'm not sure if you want to say a few words before we end, but this has been a great session and I'm hoping that you guys found value in the information.
Thanks, Marcia. I don't have anything to add. Just really glad to see everyone here. And we still have 254 participants on with us right now. So clearly, this information was really valuable and it was awesome to see everyone here.
Excellent. Excellent. All right. Well, everyone, please have a wonderful holiday season and stay healthy. Good night.
Good night, everyone.
Thank you. Good night. Bye-bye.
Bye now.